matter what kind of work you do, you come across unique and potentially fatal hazards every day.
For example, you may face risks such as slips, trips and falls, back injuries, electrical hazards, fire hazards, infectious hazards, and chemical hazards. An instant of neglect can cost you a lot of trouble. There are many potentially dangerous situations within the healthcare field. Some you can anticipate, some you can't. The best ways for you to avoid a back injury are to use proper techniques for lifting and transferring patients and to maintain good posture. Learn to use your body safely. Always use proper body mechanics when lifting to prevent injury.
During a lift, bend at the hips and knees. Lift with your leg muscles, not your back or arm muscles. Avoid any twisting motion. Never lift a load higher than your waist, and keep the load close to your body. Always ask for help if something seems too much for you to handle safely.
And take special care when lifting and transferring patients. Each year, healthcare workers and patients suffer pain, injuries, and death from shocks, fires, and explosions caused by electricity. But electricity can be managed safely if you take sensible precautions.
Examine all cords and plugs routinely, and report or replace any that are damaged or that heat up when used. And never stretch cords or unplug equipment by tugging on the cord. Always use grounded or 3-hole electrical outlets. Don't use damaged outlets, and don't overload them.
Don't use any electrical device that blows a fuse, trips a circuit breaker, shocks, overheats, or appears damaged until it is inspected and repaired. And always shut off power and unplug equipment before attempting any repairs.
Disconnect electrical equipment from the power source before cleaning. Know what to do in an electrical emergency.
If an electrical fire breaks out, follow your fire emergency plan. Fire is another hazard that can and does happen. No one likes to think about fire, but everyone needs to know how to respond. Here are some basic rules to follow in case of fire.
Stay close to the floor to avoid inhaling too much smoke and exposing yourself to deadly heat. You must minimize splashing, spraying, and spattering.
Dispose of all medical waste according to your care center's policy and your state's regulations. While at work, remember these rules for your safety. Don't eat, drink, smoke, apply cosmetics, or handle contact lenses where there is a potential for exposure to infection. Good housekeeping protects every healthcare worker, and it's every worker's responsibility. For example, a contaminated sharp carelessly discarded in a trash can could jab the person handling the trash.
Your facility's exposure control plan lists specific methods and regular schedules for cleaning environmental surfaces that may be contaminated with potentially infectious substances.
Appropriate PPE may include gloves, gown, goggles, face shields, and resuscitation devices. Follow your agency's policies on the appropriate use of PPE in your setting. Remove PPE carefully to avoid contamination of clothing and skin. Here's how. Wash your hands and wrists thoroughly under a stream of running water with an antiseptic agent. Wash under rings and fingernails. Rinse completely. Dry with a paper towel. Discard it. Then, turn the faucet off using a clean paper towel. OSHA requires your employer to provide a hazard communication or HAZCOM program to make you aware of any chemical hazards that exist in your work area.
You'll receive special training on how to read warning labels and material safety data sheets called MSDSs.
Radiation's effect on people and the environment are often controversial.
So, never touch items or areas so labeled. As you have seen, you are exposed to many hazards at work every day. By using your common sense and following simple guidelines, you can be safe. You may have thought of other situations that put you at risk that we left out. That's good. You're thinking. You're becoming aware.
Your health and safety are really up to you. Ask questions to be sure. Be aware. Be healthy. Be safe.